Yep.
Here's Eric. Welcome, Eric.
Eric Bauer.
Hey, there you are. Well, we were just debating electric engines and gas power. I think we had the same debate with you about 2 months ago.
Yes, indeed.
Yes, indeed.
And I'm all in favor of electric engines if you can get the cost down.
Yeah, there you go. Well, we were just talking about California and what could conceivably be Oregon, Washington, and Nevada that is going to be taxing owners of electric cars as much as $500 to $1,000 a year because they are using the roadways and, of course, not paying gas taxes.
Yes, you know, somebody has to pay those taxes.
Oh, man, it never stops. So how are you guys doing?
You know, that is interesting. I hadn't thought of that issue, yeah.
Well, you knew some politician somewhere would. But anyway, so how are you guys doing?
We're doing great at RMS.
So what?
We're busy doing a lot of different things and, moving forward in an exciting path here. It's been a busy summer. This is our trade show time, so we've been running around to a number of different trade shows, both in Europe and in the U.S., and we also had we just recently had all of our customers in Europe together. We all pulled them all into a meeting in Budapest. So it was the first time I ever went to Budapest, Hungary, but we had all of our European customers in, and we shared with them our vision for the business and where we're going and all the improvements, and they were very excited about our future and our relationship with them. So we're having a great first quarter. We've exceeded all of our financial numbers for the first quarter, so we're doing really good. Have a lot of exciting things coming along in terms of new products that I can't really share openly yet because it's highly confidential, but we're investing in new products, and I think we have some great things that we'll be launching in the near future, and we have new packaging and new marketing and all kinds of exciting things going on.
You could share your secrets with us. We only have a few Russians listening, so you're good to go.
Well, as long as Donald Trump isn't listening.
Yeah. I've got a question. A few months back, you had mentioned that you guys were searching for a new hub, a manufacturing hub. Is that you still looking?
Yes, we are. In fact, we're looking for a new building. We've the business has outgrown the building that we've been in. We've been in this our current building for 20 years, and we've just flat out outgrown this building. So we need to find a new building. And I actually have a meeting this afternoon with a local contractor who's going to show us some designs for a building that they're building, which is in the local area. We're not going we're not going to disrupt our current workforce and anything at this point. So we are looking for a building in the area, and I think we found a location. So we have a meeting this afternoon to discuss the particulars and see whether or not this opportunity may pan out for us.
Well, that would be great.
Yeah, we're very excited about it because this particular contractor is willing to build to suit. So he has a location, and he would actually build a building to our design. And it's always better when you're in the type of business we're in, especially where our products are made in clean rooms, and there's a very particular flow that has to take place, and we are also a warehouse hub for all of our U.S. customers. So it's best to actually design a building that kind of fits your needs,
sure,
as opposed to go into an existing facility and try to renovate it and force fit yourself into it. So we're hoping that this will work out with this particular builder, and maybe we can come to actually design a building that would be ideal for us.
Well, and I think what's neat there, and I know you had mentioned that you were looking possibly in Jersey or other places like that. I mean, boy, if you could keep it local, you wouldn't disrupt any of the employees, which I'm sure is a primary goal of yours.
Yeah, it's very important to maintain a stable workforce in any company today. Our turnover is really relatively low. We just did a study of companies similar to ours, and the turnover in those companies is been in the 15% range. So can you imagine, 15% of your employees turning over every single year, and our employee base has been running turnover is about 4%. So we're substantially lower than many of the companies that are in our similar industry or in this area. But turnover is really expensive, and because of the recruiting costs, the constant retraining of people. So you want to maintain a stable workforce as much as you can for as long as you can. And we've been able to keep our turnover really relatively low for an organization our size in this particular area.
That's great.
So we're pretty happy about that.
Yeah, that's great. I think our newest employee came to us about 15 years ago. I mean, we have
there you go. That's good.
Yeah, we've been very, very blessed. There's no doubt about it. Yeah.
Yeah.
So tell us.
Turnovers are very expensive for
Oh
companies
yeah,
these days.
you bet it is. You bet it is. Well,
So
tell us
we
about.
put a lot of time and effort into. In fact, we have a set of goals for our company, and one of those goals is our really driving improvements in our culture. And culture is one of the most difficult things to change in a company. It's very easy to change procedures or to change products, but once a company has an established culture, it's a very difficult thing to change culture and to move it in a direction that you want it to go. And so we've sort of refined our goals for our culture. And when I talk about culture, I talk about things like communications and teamwork and the things that go into creating an environment where you can minimize the turnover, where people really like to work there. They want to stay there and want to work there. And so we have a very concerted effort as an executive team to build a culture here that where people really get up and really enjoy coming to work every day. And I tell people who work for me, if you don't like what you're doing, come to me. Let's find something that, especially for that we really focus on trying to hire exceptional people. And so you don't want these people to leave. And so generally we try to move people around, give them challenging assignments. We put them on teams and have them solving problems as teams. So you build a culture that is motivating to people, that they come in and they like the people that they're working with. They like the communications from management. They're aware of everything that's going on in the company and where we're going, what the vision of the future looks like. You do this, and all of this takes a little effort on part of the executive team to take the time to have the communications and everything that you need to go on. But overall, it lowers your costs. You have more productive people. You have less turnover in the company. So it's well worth focusing on the culture within the business to move it forward.
Wow, yeah, it's amazing. You've hit everything right on the head, and sure, retention is everything. There's no doubt about it. What's the reaction been around? You talk about going to the shows. What's the reaction to RMS Medical?
The reaction's good, very good. Our customers continue to be very excited about our products. Our products are the highest quality products available in the marketplace. So, we sell medical infusion devices, the pumps and the tubing and the needle sets, and our devices are absolutely the best on the market, and our customers continue to come back to us and tell us that. And for example, our needles are the sharpest needles. They give you the best high-quality flow of the drugs, and people love them. And one of the shows that we were just at was IDF, which is it's an autoimmune deficiency foundation, and it's more of a patient-focused show. And it's one of the few shows where you go to and you actually have patients where you have children who come who are using our systems, you have adults who are using them, and they come to the show to learn more about the infusion because they're on these drugs for their entire life. And they want to know what are the best products out there, how to solve problems, how to troubleshoot. And it's really exciting to actually talk to the patients themselves. And it's so strange to have a 10-year-old child walk up to you and start talking to you in terms of medical terms, talking about how the infusion works, what kind of needles they use, the length of their needles, and you say, wow, is this really a 10-year-old child who? But their life depends on their drugs, and they infuse either once a day or once a week or twice a month, and their life is changed by using our products. So they just love us. They literally come to our booth and say, don't change a single thing. I love your products. They actually really substantially change my life. And what's key about that is our products are used for home infusion. Prior to our products, a lot of patients had to go to clinics or hospitals or doctors' offices to get their infusion of their drugs. And by virtue of the fact that they can use our mechanical device, which doesn't have any battery power requirements or you don't need to be plugged into a wall. You can be sitting at home watching TV, or you can put it in its little carry pouch, and you can go out and walk the dog while you're infusing. And many people do this. They put their needles in, and they start their infusion, and then they go out and walk the dog. And by the time they're done, their infusion is done, and they have the freedom to do whatever they want to do. It really changes their lives. And when you go to a show like IDF and you talk to the patients, it really hits home. It really is. It makes you feel fantastic to be able to have this much of an impact on people's lives, and to have them come up to you and say, "Wow, you've changed my son or my daughter's life," and with these products. So we're very excited about this. Our customers, our patients, everybody continues to rave about our products. No other competitor out there has anything like what we do. So we're very excited and continue to get all the positive feedback from the trade shows.
Yeah, you see a young person walk up to you like that, and you think it's Doogie Howser or something, right?
Yeah, it's amazing. They spend a lot of time focused on their care and what they do, and they really pay attention to their nurses and their doctors, and they learn a lot. It's amazing how quickly they learn as children, because they're doing this so frequently that they have to understand. And they start off with the nurses inserting their needles, their infusion needles, and then their parents usually end up doing it, and then very shortly after that they just do it themselves, and they don't think twice about it. They just insert the needles, they put their drug in their pump, and they turn it on, and then they're free to do whatever they want to do.
And you're doing a lot in foreign markets. Can you elaborate on that?
Oh yes, we're expanding. It's actually a misnomer to think about us as a U.S. Company, even though the majority of our sales are currently in the U.S. We are expanding rapidly throughout Europe right now, and our chief medical officer just got back from Asia, where he made a tour of a whole number of countries in Asia, and we have just taken our first order from Vietnam and gotten registration in a number of Asian countries. So, before we can actually sell our products in countries, we have to be registered with their governments or their version of their FDAs. And so we are actively engaged with a number of governments to get to push through our registrations in those countries. And we have clinical trials going on in many locations throughout Asia and Europe, and also continuing to do those in the U.S. as well. We just had one of the major drug companies, Shire, came in and wanted to work with us on expanding their sale of a new drug, and they did a quality audit of us, and literally, I think it was like just a couple weeks ago, they actually announced to their entire organization that we are an approved supplier to Shire. So Shire is going to be a great company to work with, and we're going to help them expand the use of their drugs throughout the world.
Wow.
And,
that's a
so
huge
we are working
announcement.
closely with the drug companies as well.
That's a great announcement. Yeah. Wow, Michael?
Yep.
What would a user of the product acquire through utilization? What would they be? How would they be improving themselves?
How would a user, you mean in terms of the drugs or our device? Well,
yes.
Our patients right now, this is one of the other things, is the majority of our patients are immune deficient patients. They have compromised immune systems. Their bodies aren't creating enough immunoglobulins to protect them from getting sick on a regular basis. So basically their immune systems aren't capable of fighting off even the common cold. I mean, a lot of them have to avoid contact with their friends, and a lot of them can't leave their homes unless they get their immunoglobulin drugs. And so the drug companies, whether it's Shire, CSL, Octapharma, a number of other companies, they're all creating these immunoglobulin drugs, which are, I look at them and I think these are like miracle drugs, because they essentially enhance the immune system of these patients. And these patients who previously could not go out, the kids couldn't go out and play with their friends, they can't go to school for fear that they would actually catch a cold and get pneumonia. And so these immunoglobulin drugs actually boost their immune systems so that they can fight off all of these common colds and viruses and things. And so the drugs are expanding and becoming more and more available on the marketplace. And all of these drugs need a delivery device. So in the past, people would put them in through an IV or through a PICC line or something like that. But when you do that, you get a huge surge within the body where the immune system in the body jumps up really quickly, but then it drops off fairly quickly as well. And they talk about these as the trough levels, the levels of the immunoglobulins within their systems. So basically, when you stick with some of the traditional systems of delivery, like IV delivery, the trough levels jump way up and then they come way down. And the patients have a hard time maintaining a steady level of this drug. Well, using a subcutaneous delivery, which was what we do, a subcutaneous is where the drug is delivered just below the surface of the skin into this subcutaneous tissue. And when you do that, you're not putting it directly into the bloodstream. So you're basically creating a deposit of the drug within the patient's body, typically like in the abdomen level, abdomen area, or in the thighs. So you create a deposit of this drug in the patient's body, and the body absorbs it slowly over time. rather than putting it directly into the bloodstream. Well, when you do this, what all the studies show is that the trough levels remain constant then over a much longer period of time, so that the patient's protection is not going up and down, up and down, up and down. They maintain a steady protection over a longer period of time. So they're healthier. They become healthier patients over a longer period of time. So subcutaneous delivery is the way that these drugs are being delivered going forward. And we're learning all of this through these primary immune deficient patients, that subcutaneous is a better method of delivering drugs. So now what we're seeing is doctors are saying, hey, if this is true for this drug, why can't I do the same thing with pain medications? Why can't I do the same thing with antibiotics and have the same positive effect? So they're looking at a number of different indications, a number of different drugs now. And so the use of subcutaneous delivery, which is what we do with our pumps and our needles and our tubing, is becoming a growing marketplace because it's a more effective way of delivering the drugs to the patients. It actually makes them healthier, and so the patients get a huge benefit from it. And not only that, they don't have to go to a clinic or a hospital to get this. They can do this at home. So our business is not only expanding within the primary area that we target, but it's expanding into a number of different indications where people are now experimenting with other drugs and delivering them through subcutaneous. So we're pretty excited about the fact that not only is our primary market growing, but the secondary market for all these other drugs is growing as well, and many drug companies are developing new drugs specifically for subcutaneous delivery, and finding that they can be far more effective and solve patients' problems by doing this. So our future is really bright. It's an ever-growing business, not only from a drug company level, but patient levels, indication levels, on a global basis. It's growing everywhere, and the whole market is moving to the home infusion. So, people want to do their infusions at home. They don't want to spend an entire day sitting in a hospital doing their infusion when they can sit at home and do it in an hour at home.
Sure.
So,
yeah.
It's really convenient for the patients.
So Eric, how large a market would you say Vietnam is going to turn into for you guys?
If I had a crystal ball, I probably wouldn't be working. But we are very optimistic because whether you realize it or not, a market like Vietnam, it's funny, I don't want to give away my age, but I remember, the Vietnam that was the wartime Vietnam.
Oh, yeah, so do I. Yep.
And it is not that anymore. There's a wealthy class of people there now because a lot of manufacturing has moved there. There's a huge middle class now. It's very much a modern day country in many respects. So they want to have modern day technology, modern day medical drugs, and so the drug companies are launching there. We basically went into Vietnam, for example, following a drug company. So the drug company said, we need your help. We can't launch our drug here without you guys. So we followed them in. We got our registration. And so as the drug continues to grow and the doctors continue to prescribe it, then basically we ride on the coattails of the drugs into these countries. So we believe that market will continue to grow for us. It's just starting out. And there's really no telling how big it'll get. It all has to do with the patient population and the number of patients that are being diagnosed in this particular case with primary immune deficiency. So, which tends to be somewhere between 5 and 7% of the population. So it can be quite substantial going forward.
Wow.
How long does it take to put the device on for a patient at home?
The device itself is once you basically you start by washing your hands, and then the drugs are delivered in a glass vial, and you transfer the drug from the vial into a syringe, and then basically you just connect the tubing and the needles. You prime your tubing, and then you just insert the needle. So we're talking just a matter of minutes. I mean, once you're trained on doing this, it's just a matter of minutes. You insert the needles, and you put a tegaderm over them to hold them on, and then you literally it's just one switch on the pump. You turn the switch on, and it starts the infusion process. Now, the infusion process itself typically takes about an hour or maybe a little bit longer, because you're infusing a fairly large quantity of drug at a very slow rate, because you want to put it in slowly so that you're not hurting the tissue of the skin. And so it takes about an hour and a half sometimes for an infusion to be complete, but the actual setup is only minutes. The actual setup until you're doing it. So what the patients love is they can do it at their convenience. You know, when they're finally sitting down at night and they're going to watch a TV show, they can, basically do their setup, insert their needles, and start their infusion. They can watch their TV show, and by the time the TV show's done, the infusion's over with. So it's a huge convenience factor, and that's one of the things we heard over and over again from patients is they just love being able to do this at their own convenience. And and the funny thing is, people say, well, why is that a big deal? It's a big deal because the more you can make it convenient for the patient, the more compliant the patient is. That means that they're taking their drugs at the right time, on the right schedule. And when you have compliant patients, you have healthier patients because their trough levels remain constant. They are just healthier. They're less likely to catch a cold or get pneumonia or to get sick. And so compliant patients lead to healthier patients, which leads to lower overall healthcare costs.
Wow,
So
you got a great story,
this is what it's
Eric.
all about.
Yeah, it
Great
is.
show.
What's your website at RMS Medical?
It's rmsmedicalproducts.com.
All right, and Michael, how's that stock look?
It looks fantastic. I mean, it really looks like it's poised to go. It's the cheapest stock on the board.
All
It
right.
is
Yeah,
a great buy here.
We are
REPR is the symbol.
yeah, REPR.
REPR, yep.
All right, guys. Well, thank you so much, Eric Bauer, President and CEO of RMS Medical. Thank you very much. Tim Connolly, our oil expert as always. And, of course, Mike King and Charles Moskowitz, who bring you Money Info. Don't forget that newsletter. Every Sunday it comes out. And, boy, I'll tell you, you talk about informative. This is WPSL Present Lucie.